Alrighty. All right, so now it should just be a few more seconds. And then... Okay. You're good, Donna.
Okay. Good evening, everyone. We want to welcome you to our Wednesday Wellness webinar. Today is June 23rd, and this is our bi-monthly webinar series that we host. I'm going to go ahead and share this screen. Maybe it worked when we tested. Okay. There we go. Sorry about that. Slight delay. So I want to go ahead and introduce to you our team. And there we are. The wellness program team consists of, oh, now it wants to do its own thing. I apologize. Okay, let's try that. I want to introduce our team. So Kamal Erkin is the chairman of United Medical ACO, and he could not be with us this evening. Again, my name is Donna Gunkel. I'm the director of clinical integration and oversee the diabetes program, the dietitians, and many of the other clinical programs here at United Medical. We also have, it's like changing by itself. We also have Dr. Ripu Hundal. He is an endocrinologist within our network, and he is the program director. We have Tim McHugh. He is a physical therapist with SOS and also assists us in going over many of the items related to fitness and exercise with diabetes. And then we have Amy Wilcoxon, who's with us tonight, as well as Jacqueline Tomasetti, who is our licensed clinical social worker. So I'm going to go ahead and turn it over now to Amy. She's one of our registered dietitians and certified diabetes educator.
Thank you, Donna. So I'm Amy Wilcoxon, as Donna said, dietitian and diabetes educator. And in 2 Wednesdays a month, we run our Wednesday webinars. So where we talk about all things related to diabetes, and we've been lucky enough to have lots of different specialists come on. They are all available on our YouTube channel to watch. So if this is the first one you're catching, I encourage you to go back and see with our endocrinologist, cardiologist, learn about kidney problems and feet and what's going on in your head and exercise. So there's a lot of different content available. And then tonight, we're lucky enough to have Katie Gallivan with us. She is our physician assistant with United Medical Clinic, and she is going to talk about supplements for diabetes, which I know we get a lot of questions about. I have diabetes. My friend swears by this from the health food store, and should I take it? So I'm so happy to have you here to talk about it with us tonight. I will turn it over to you. Thank you so much.
Thank you, Amy. So I'm Katie Gallivan. I'm a physician associate at United Medical Clinic. I'm very excited to be joining you guys today for this wellness webinar. So thank you for having me. And I'm excited to talk about diabetes supplements. So I treat a lot of patients with diabetes, and we do get a lot of questions about diabetes supplements and if it's safe, if it's effective. And hopefully I can touch on some of the more common ones and some of the ones that are a little bit more studied, but there are so many diabetes supplements out there. And we definitely want to be careful before taking any of them. All right. So diabetes supplements make a lot of claims that they can decrease your blood sugar levels and improve insulin resistance. There are so many different diabetes supplements on the market. However, a lot of them don't have enough evidence to show that they're actually effective for treating diabetes. So most supplements really don't go through the clinical trials that they need to, so we don't know that that it's truly effective at decreasing your glucose levels or your A1C. And the truth is that nothing replaces a nutritious diet. So instead of trying to focus on taking diabetes supplements, it would be more important to focus on trying to eat a wholesome, balanced diet, getting all the nutrients you need from eating plenty of vegetables, fruits, whole grains, lean proteins, and really getting all your nutrients that way. And then the other thing is getting daily physical activity. So if you can live a healthy lifestyle, you really shouldn't need to take the supplements. And there's no natural cure for diabetes. So a lot of supplements on the bottle say that they're natural. And really what you really should do is stick to the prescription medicine that you are prescribed by your provider. So there's no replacement for the FDA approved clinical trial medications that have been shown over and over to treat diabetes. So I would highly recommend any traditional diabetes medication over any supplement. Okay. Now we want to be careful when taking diabetes supplements. So here's a quick warning. Supplements are not regulated by the FDA like typical prescription medicine is. So supplements are actually presumed safe until the FDA receives multiple reports of the adverse effects. So supplements are put on the market, and until we have a bunch of reports saying that there are harmful effects, then we take them off the market. So in the meantime, a lot of bad things can happen before we know that they're unsafe. So a lot of supplements contain unknown ingredients. If they claim to have an active ingredient in them, that's not necessarily actually present in the supplement at all. And especially when taking supplements from other countries, you want to be careful because a lot of the ingredients in the other countries aren't necessarily even approved in the US at all. So a lot of supplements have dangerous side effects and interactions with the medications you're already taking. So before you take any supplements, you definitely want to consult your physician or your provider and tell them what supplements you're interested in taking, why you're interested in taking them, and have a discussion about the medications you're already taking and how they might interact or why they might not necessarily be safe. So we all think of supplements as natural, but natural does not necessarily mean safe. And you always want to be careful before taking any supplements. So with that, I'll talk about some of the more well-known supplements and some of the ones that are a little bit more studied. Okay, so chromium is the first supplement that we're going to be talking about. And this one has been studied and it is shown to be pretty effective. So I would recommend this one over some of the other supplements that we're going to talk about today. So chromium has been shown to potentially increase insulin receptor sensitivity. It may decrease the fasting and postprandial glucose, so your blood sugar before and after you eat. And then it may also decrease fatigue, excessive thirst, and frequent urination, which are some of the common side effects or some of the common symptoms of diabetes. And the reason that replacing chromium is important is because diabetics lose a lot of chromium in the urine more than the average person. So if we're losing a lot of chromium with frequent urination, we need to replace it. So in one study in the United States, it showed that after 4 months of people with diabetes taking chromium, there was a statistically significant decrease in their A1C and their glucose compared to placebo. So again, this one study showed that chromium was effective, but it would be necessary to have a lot more studies and a lot more patients over a longer period of time in order to see if chromium's actually effective and see if we would actually recommend it. So some of the side effects of chromium that you want to be careful when taking are kidney and liver failure. So I would definitely not recommend it if you have a history of any kind of kidney failure or liver disease. And the other thing is chromium can interact with multiple medications, including antacids, proton pump inhibitors, beta blockers, corticosteroids, and NSAIDs. So you really want to be careful before taking this. Again, consult with your provider. And the recommended daily dose is 500 to 1,000 micrograms per day. All right. And the next supplement that we're going to be talking about is alpha lipoic acid. So alpha lipoic acid is also pretty effective. And I would recommend it for certain people with diabetes, but not everyone, and I'll explain why. So alpha lipoic acid is an antioxidant. It's naturally found in broccoli, spinach, peas, potatoes, liver, and skeletal muscle. And alpha lipoic acid decreases the symptoms of diabetic neuropathy. So it decreases the symptoms associated with nerve damage from diabetes, but it doesn't necessarily prevent neuropathy, and it doesn't slow the progression of it. So it's actually approved in Germany for treating diabetic neuropathy, although it is not approved in the United States specifically for that reason. So in animal trials, it showed that improved blood flow to nerves, neural regeneration, and distal nerve conduction rates. So again, that's in animal studies. Human studies showed that it did improve pain, burning, paresthesias, and foot numbness compared to placebo. And those are some of the more common symptoms of diabetic neuropathy. So it has been shown to improve those symptoms. And then it also might slightly improve cardiac autonomic neuropathy, which is damage to the nerve fibers that innervate the heart and blood vessels, which is a commonly overlooked complication of diabetes. The important thing to note is that alpha lipoic acid does not at all affect your blood sugar. So it doesn't decrease glucose or A1C. It really only treats the diabetic neuropathy symptoms. And the recommended dose is 600 to 1,200 milligrams per day. All right, the next supplement is garlic, which we've all heard of before. And a lot of people have looked into this for treating diabetes or lowering A1C levels. There's potentially some evidence that it increases pancreatic secretion of insulin from the beta cells. In animal studies, it has shown improved glycemic control, but in human studies, there's really not enough evidence. So in human trials, there was really no improvement in the blood sugar or insulin after 1 month of being on garlic. The good news is the garlic is generally safe. So even if it's not proven to treat diabetes, it is pretty safe, and it also may benefit hypertension and high cholesterol. So we're kind of looking into the benefits of garlic for those as well. All right, so our next supplement is cinnamon, and it's another thing that we've all heard of before. So cinnamon has been used since ancient times for medicinal purposes. We can use it as a ground spice, a tea, a capsule, or an essential oil. And the active ingredient in cinnamon is hydroxychalcone, and that increases the insulin action. So one study showed that cinnamon was able to decrease the blood sugar levels by 18 to 29%. But again, that's one study. So we need a lot more studies before we can definitely show that cinnamon is a good treatment for diabetes or for decreasing blood sugar levels. And then cinnamon also may improve your cholesterol and triglyceride levels. So cinnamon itself has not been shown to lower A1C at all. So in the long run, it might not actually be effective. And the important thing to note with cinnamon is that it may worsen liver damage. So if you have a history of any kind of liver disease, you definitely want to be careful before taking high amounts of cinnamon. And that's because coumarin is a chemical compound in cinnamon, and that's been shown to cause liver damage in high doses. So the recommended daily dose of cinnamon would be 1 gram or about a half teaspoon daily. All right, our next supplement is magnesium. So magnesium is found naturally in seeds, nuts, spinach, and bran cereal. So the good news is if you're eating seeds, nuts, and spinach, you'll probably get enough magnesium. But if not, you can always take a magnesium supplement. Now, low magnesium levels are actually very common in patients with diabetes, and having low magnesium has been associated with neuropathy, retinopathy, thrombosis, and hypertension, some of the common complications of diabetes. So I'm not saying that low magnesium levels cause these, they're just kind of associated with each other. So magnesium controls the transport of the sugar across cell membranes, and it improves the uptake of sugar in peripheral cells. So magnesium may also decrease serum fructosamine, which is an indicator of your average glucose over the past few weeks. So a lot of us are familiar with A1C, which is a measure of your blood sugar over a period of a few months. And fructosamine is similar to that, but it's more of a short-term indicator. And magnesium may help improve that. However, more studies are needed before we can definitely show that it's effective. All right, and bitter melon is not very common around here, but it's a green fruit similar to cantaloupe or honeydew, and it potentially increases tissue uptake of glucose and increases muscle and liver glycogen synthesis. It can be eaten as a capsule, it can be eaten raw, or tea or juice. So some of the side effects of bitter melon are GI upset, gastrointestinal upset, headache, and hemolytic anemia. And the important thing to note is it's not recommended in pregnancy due to the risks of birth defects or miscarriage. So definitely want to be careful taking that in pregnant women or women of childbearing age. And the recommended dose of that is 50 to 100 milliliters, or approximately 3 to 6 tablespoons. All right, our next supplement is fenugreek. So this is an herb native to the Mediterranean and Western Asia. You can take it as a seed, tea, or capsule. And the seeds may lower the glucose by stimulating the release of insulin. And because the seeds have a lot of fiber in them, they slow gastric emptying and they slow carbohydrate digestion. Fenugreek has also been studied for its effects in lowering total cholesterol and triglyceride levels. And the interesting thing about fenugreek is it tastes and smells like maple syrup. So it is kind of sweet itself. Some side effects of fenugreek, including gas, bloating, and diarrhea. And a lot of that is due to because it's high in fiber. And then fenugreek is also contraindicated in pregnancy because it can potentially cause uterine contractions. And I'm not sure if that's like actually proven, but it seems to be associated with that. So you got to be careful. And then the other thing about fenugreek is it interacts with blood thinners. So if you're taking any kind of blood thinner, you definitely want to be careful before taking fenugreek. Again, talk to your provider. So the recommended dose of fenugreek would be 5 to 100 grams per day. All right. And the last supplement that we're going to be talking about today is Gymnema Sylvestre. So this is a woody plant from India. It's also known as gurmar or sugar destroyer because chewing the leaves makes you lose the ability to detect sweetness. So if you chewed a leaf of the gymnema or you took some of the extract and put it on your tongue and then you tried to eat something sweet, you wouldn't be able to taste the sweetness, which is interesting. So gymnema can be taken as a water-soluble extract, which is shown in the picture here, or you can drink it as a tea, or you can take it as a capsule. So in animal models, it shows that it shows regeneration of the islets of Langerhans, which are the pancreatic cells that secrete insulin and glucagon. It has been shown to decrease glucose and increase serum insulin levels. So that's all in animal models. So in human models, 2 of the clinical trials showed improved glycemic control when they were used as an adjunct to traditional diabetes treatment. So alone, Gymnema wasn't very effective, but when you used it in addition to the typical medicine that we use to treat diabetes, it was actually shown to improve blood sugar levels. The good thing about Gymnema is it also may improve your cholesterol levels, and the recommended dose is 400 to 600 milligrams per day. All right, so overall, the bottom line when taking supplements is you want to proceed with caution. So before taking any supplements at all, whether you have diabetes or you have any other medical conditions, is you want to talk to your provider. You don't want to just order supplements over because you saw them on an advertisement and they made all these claims that they really help decrease blood sugar levels or improve insulin resistance or decrease A1C. You have to be careful and do your research. So it's more important to take the FDA approved medicine that your provider prescribed. Always be compliant with taking your prescription medicine rather than kind of trying to rely on supplements. So anytime you are starting a new supplement or any medication, really, you definitely want to check your blood sugar levels more regularly and see how the supplements affect your blood sugar levels. So a lot of them do make these claims that they can decrease your blood sugar levels. It's possible that you can have hypoglycemia and your blood sugars be too low if they are actually effective. So we want to make sure that that doesn't happen, especially used in combination with your traditional diabetes medicine. And then really the most important thing to take away from this is that if you're living a healthy lifestyle and eating a nutritious diet and you're getting plenty of physical activity, you really shouldn't need any supplements. Let food be your medicine, eat plenty of vegetables and fruits, and hopefully we won't need the supplements at all. So some of the supplements can be safe, they might be effective, but I would say at this point, there's no proven evidence that they effectively treat diabetes.
So I'm going to stop sharing for a moment because usually at this point, Katie, we have some questions.
Okay.
I'm sure Amy will have some probably questions that she's asked on a routine basis by her patients. So we like to get some of those questions out there just because then it's part of our presentation. And as other patients with diabetes, watch this, then they get the benefit of a lot of that. So Amy?
I'm so glad you talked about cinnamon because that's definitely, I feel like 10 or 20 years ago, it was the big thing, cinnamon, and it's not quite as popular, but there's still a lot of people doing it. I have people that swear to me that chewing cinnamon sticks, which I can't imagine, has significantly lowered their blood sugar. And I'm always, if you feel that it doesn't seem to be harming you.
Yeah.
So if you feel that's helpful, and bitter melon is one I actually get a lot of questions about because I think there's a couple different cultures where it's really popular where they're using bitter melon. And then fenugreek too was something I had a question about. So fenugreek is something I hear about for weight loss too. It's commonly used also with nursing mothers. I'm sure that you've seen because it's supposed to help with milk production. But I've had people who it's commonly more eaten like as a spice in their culture, but eat it for weight loss. And I think it's because of the fiber.
Yeah. That seems, yeah, I did some research and I agree. It seems to be that the fiber is what's slowing the gastric emptying. So I think the seeds are the more effective way you can take it, but I agree.
And it's interesting because I've had people taking it for weight loss, and what you said about maple syrup, and they smell like maple syrup when they come in because it kind of comes out of their pores, like the garlic does also, which is, and that was interesting to see because there's a lot I see about garlic and cholesterol, but I had not seen as much about garlic with diabetes.
Mm-hmm.
So, and it was the tablets that that people are not just eating cold.
Yeah, so it said like the tablets, you can have it dried, like crushed as a powder, or hopefully no one's just eating bites of raw garlic. But
I don't know if that's worse than the cinnamon sticks.
I don't know how their breath would be after that.
Exactly, that's true.
Yeah.
And I guess one of the things that I wanted to point out is, you know, sometimes too, with some of these things we're talking about, right? Like the cinnamon and the garlic. I mean, sometimes we get some of that in our diet as we eat our foods anyway, right? That we don't have to look at, oh, I've got to go take a half a teaspoon of cinnamon and, you know, sprinkle it on something every day. So I guess one of the things I wanted to ask is you went over a lot of those. And so do patients typically think that they're going to need multiple supplements? And if they were going to try something, do you usually recommend that they try like one at a time? And then that you would maybe even recommend something based on their particular situation, right? Because not everybody who has, not every patient with diabetes has the same situation. So it might be good to know, like you said earlier, what medications they're on, but also what their dietary, their current diet consists of as well, right? Before we recommend that they start taking some of those things that they would get regularly within their diet.
Exactly. Yeah. So I think most people are asking about a specific supplement that they've seen advertised or often that they've heard from someone else. So they have a friend who said, oh, I take this and it helped my blood sugar so much. And then they come in asking, well, is that a real supplement? Can I take it? Is it safe? And I think overall, as long as it's safe to take the supplement, I would say, yes, you can take it. There's no proven studies that it's definitely effective for diabetes, but as long as it's safe for your medical conditions and doesn't interact with your other medications, it's worth a try. And I think it is best to start one medicine or one supplement at a time and see how that affects it. If you're taking multiple supplements, starting them at the same time, we're not really going to know what's effective. And if something did lower the blood sugar, well, which one was it? Or if you have any kind of side effects or symptoms from it, you're not going to know which one it is specifically. So yeah, I would start one supplement at a time as long as it's safe. And with all my patients, I talk about their diet and how they're eating, what they should be eating, what they shouldn't be eating, and how that kind of relates to the supplements as well.
And I think too, the one thing I always point out is they really need to talk to the pharmacist as well, because the pharmacist I always feel like is that last line of defense about what interacts with what. And they tend to know the supplements, they know all the medications. So they're usually a really good resource. And sometimes the person will say, well, I can't get in touch with my provider, or, you know, I called, it's after hours, but there's always somebody, well, not always, but the pharmacy's open for a long time. So they're usually able to get in with somebody.
That's actually a really good idea. I haven't thought of that before.
I rely on the pharmacist quite a bit. They can show you how to use the meter. They can do this.
Yeah.
Well, because there are pharmacies, right? I mean, not every one, but like you said, Amy, some of them are open till 8 or 9 at night. We know they're open on the weekends, and even some of them are 24-hour pharmacies, right?
Yeah, and they really, I mean, they know all their interactions. So, and they're usually really good about, well, you know, try this instead of this, or this instead of this, or, oh, you can't take that. That's not safe.
Good resource.
Yeah.
All right. Are we ready to resume, or did you have any other questions?
Katie, anything else?
Mm-mm.
Okay. All right.
Yeah.
All right. Hopefully when I go back in, it seemed to be having
Maurice,
mind of its own. So I'm gonna pause just for a second because I think before I didn't think it was responding.
okay. I was gonna say, I thought Katie had another slide.
Okay, sorry about that, Katie.
Oh, there wasn't much information on that one anyway, so it's
We
okay.
did talk about the bottom line though.
And they're nice
So,
pictures.
right. And these are
Sources.
okay. So anything you wanted to mention about that, Katie?
No, but I do think it's important when you're researching supplements or anything else to look on sources that are accurate and trustworthy. So when I was doing some research, I looked up some YouTube videos, and it's just like amazing how wrong a lot of them are, and they're completely inaccurate. And it's sad that if people are researching these things on their own, how like inaccurate the information that they're going to find is. So make sure you're using good sources.
That's a really good point. The Mayo Clinic has had a really good list of, and they're really, it's really easy to read, and it's alphabetical. So, and it gives them grades on their sources. And Hopkins also has a really good list of, they're not completely exhaustive. They don't have everything, but it's a good place to start rather than YouTube. Absolutely.
Yeah.
All right.
Okay, so since weight loss is such a part with diabetes, I decided to talk about supplements for weight loss. So as we all know, the diet and supplement industry is $1 million industry. They're making so much money, and really they're very good at it, because if you don't succeed, it's your fault. It's not because the supplement's no good, which there is no magic pill, because none of them really work. If there was a magic supplement that worked, we would not have such a problem with obesity in this country, or really in the world. So there's a lot out there, and some of them have been around for a long time. I chose a couple of the more popular ones to talk about. Can they help in addition to changes in diet and exercise? Anything that you see that might have a slight advantage, it's been done with diet and exercise. But as Katie talked about, the safety is really an issue. So some of them don't really do anything, but they're perfectly safe to take. Some of them may be harmful. They can, because they're not regulated, they can be mixed with something. One of the examples that I always give when I talk about supplements to people who believe, well, they sell it at Walgreens, so it has to be good, is that there's an herb called echinacea, which is a purple coneflower. And there is strong research that echinacea can help relieve the symptoms of the common colds. But there's 3 purple coneflowers, and only one of them relieves the symptoms, but all of them are echinacea. So when you're going to the store, you don't know which one you're getting, because it's not labeled, oh, this is the flower that actually works. You don't know exactly what's in there. And like Katie said, you don't know what's mixed in. If you look, there are, I don't know how many times a year, but the FDA does go and get inspects, and there are raids where they find that there are different supplements that are illegal. There's been cases of prescription drugs, things mixed in with supplements. And as Katie made the point, things are out there, and companies, we rely on the company to tell us it's safe, and it's not taken off the market until people die. And it's the same way it is with preservatives. It's the same way with chemical additives. Until we know that they're dangerous, they're taken off the market. Like ephedra is one of the most common ones for weight loss. It was really good. It worked really well, but it can stop your heart. So it's really dangerous. A lot of people died. So now that's illegal, but it has been found, doses of ephedra have been found mixed in, and those factories have been shut down. So you'd really, if you're going to buy a supplement, you need to check on safety, and you absolutely need to check to make sure it's a reputable brand, because at least you have that. Nature Made is a brand when people are buying vitamins. I will usually say it's one I like because it's a bigger brand. It is certified. So it's sort of the best we can do there. All right, so let's start a review of popular supplements. Okay, so apple cider vinegar, everybody's favorite these days. So the pro of it's vinegar. So I'm not, if people are going to take this, I really like them to use vinegar and not gummies or tablets, because they're actually, it's a plant as well. It's not a plant, it's vinegar. It is natural. As Katie said, that there are benefits and there are nutrients in vinegar. It can increase the good bacteria in your gut. So there is positive things there. Con, really, people who are drinking it undiluted, it will ruin the enamel on your teeth because it's vinegar. It's really acidic. It can worsen GERD. So the grade for weight loss, I would really call it undetermined. I have people who swear to me that they have lost weight from drinking apple cider vinegar before their meals mixed with water. I really honestly believe because they're drinking these giant glasses of water right before they eat, which takes up a lot of space in their stomach. So they're full. Because there's nothing really magical about vinegar. One of the things to think about is people have been using vinegar for hundreds of years. And our weight situation in this country is certainly not any better than it was before. So if you are taking apple cider vinegar for weight loss, I would use apple cider vinegar or any vinegar to make a salad dressing. So you're getting lots of things there. I wouldn't necessarily rely on it for weight loss, but you absolutely have to dilute it with a lot of water because it is vinegar and it's not good for your system to be drinking straight vinegar. All right, so next slide. So Hoodia is another popular one. It claims to suppress appetite. And this is something that comes from a lot of different sources. And there is very little research on it. There was one small study, did not show any change in calorie intake. So the concern is there may be an increase in heart rate and blood pressure. So there are supplements out there that do increase heart rate that are stimulants. So if you think about it, heart is racing, you're moving more, you're probably going to be less hungry. Appetite might be suppressed. So if we think that's there, how safe does that sound to you if you feel like your heart rate might be going up? It's not something that we necessarily recommend. The side effects are headache, dizziness, nausea, vomiting. So nothing that's going to kill you, but nothing that's really pleasant either. And there's not a lot of research that it really works. So this is something if somebody doesn't have high blood pressure and their heart is fine, it's probably okay, but it's not something that I would recommend anybody take. And there is concerns that it's not safe, but it is still on the market, but I still give it an F because I don't think it does anything. So green tea extract. This is one that's been pretty popular for a while. And I talk on this slide about green tea versus green tea extract. So people took a really, really great thing, tea, which has a lot of positive benefits, and they stuck it into a capsule. And when you take food and you stick it into a capsule, you lose a lot of the benefits because there's a lot of nutrients that work together naturally, and they work with each other in your body. Once it's a chemical process, you lose a lot of those natural benefits. So the claims are that it increases your energy expenditure, so you're burning more calories, and fat oxidation, so you're using your fat better. The studies show, and there are some more studies on this than some of the other ones, possible modest effect on weight. Drinking green tea, there are no safety concerns. And there was a larger study on people using green tea, and they did have a little bit of weight loss. They were drinking like 18 cups of tea a day to lose weight. That's a lot of tea. So again, were they losing weight because they were drinking so much tea that they didn't have time to eat and they were full, all that liquid? Green tea by itself, it's really good for your brain in terms of delaying cognitive decline. It's good for your heart. It's good for your gut bacteria. So there's a lot of benefits in tea, but again, the extract, not necessarily. It may cause constipation or diarrhea, liver damage. So if you have liver disease, this is not for you, and nausea. So I would give green tea an A because it's good, but green tea extract, not such a good grade. So stick with the real deal. Definitely better.
So Amy, I have a quick question.
Yes.
So with the green tea, are you recommending like a green tea? You know, you can buy green tea, right? Everybody.
Good question.
Like, you know,
like Lipton, Arizona green tea. Yeah. So no. I'm recommending the kind that comes in the tea bag that you have to put the boiling water over. So I'm not a fan of bottled teas. There's probably some small brands out there that are really just tea and water, but most of them have preservatives. A lot of them have sugar or sugar substitutes. So really, when we're talking about tea, you know, make it, steep it, put it on ice, but the real deal. Good question.
Okay, I just want to make sure, because I know a lot of times people, you know, when they hear something, they think of it in their world, so to speak. So, oh yes, I drink my big bottle of, you know, Wawa green
Arizona
tea
green
every
tea.
day, or Arizona green tea. So, all
Turkey,
right.
yeah, good question. Thank you. So, and I have a typo on this one. It should be MCT oil, not MTC oil, which is medium chain triglyceride. So I apologize for that. So what this is, it's a type of fat, and it was really popular a couple of years ago. It's still pretty popular. So what and some of you may know, bulletproof coffee is something people were drinking, which has MCT and butter made in the coffee. So not really the kind of coffee that I would recommend. So there were claims that it supports weight loss and improves lipid metabolism. When these studies came out about MCT oil, MCT is what's in coconut. So there's a lot of MCT in coconut. So coconut became really popular. Like, oh, people have said that coconut's bad for you, but it really must not be bad for you. The coconut that was used in the study with the MCT was not a normal coconut oil. The MCT was really pumped up that showed the research. So coconut oil is still a saturated fat. So saturated fat is still not good for your heart. We still know that unsaturated fat is better. So don't go out and start eating a lot of coconut. There are no safety concerns with adding some of this. It's really popular on the keto diet, which is really popular right now. It's fat. So, and the keto diet is 75% fat. I gave it a C because there's no safety concerns with it. Would I recommend that you take it for weight loss? No, not really. I think it's a waste of money, probably. The amount that you're supposed to take per day is not a lot. And if you're on the keto diet, I would rather that you use a little bit of this or coconut than eating a lot of bacon. So if we take it that way. But the research is still pretty small. There are other benefits with MCT. It's something that's used with people with different digestive issues, but the research for weight loss is still pretty few and far between. All right, and protein shakes are not a supplement, but I wanted to talk to them because they're really popular. And it's something that I will recommend at times too, for people who are really, really struggling to get started on their weight loss. So sometimes a protein shake or a meal replacement can be a good jump start because they don't really have to make decisions. So they've been used for a long time. You might even remember like the Slim Fast commercial, which shake for breakfast, shake for lunch, sensible dinner. And it's still out there, or Alba, which is another really older one. And I'm looking around for my Premier Protein that I used to have on my desk because I show it to people. That's one of the popular ones. So, however, if you were drinking your shake for breakfast, shake for breakfast, shake for lunch, and you lose all your weight, and then you stop and you go back to your regular meals, you're likely to gain the weight back. So the downside of using shakes for meal replacements is they can be really short term. They are really unlikely to raise blood sugar, so safe for diabetes. So the safety issues with them, the things you want to pay attention is if you have kidney disease, they are usually fortified with vitamins and minerals. So if you have high potassium, that's really something that you need to look at and see how much is in there. Is it a pre-workout shake? If it's a pre-workout, and which it'll say on there to drink before workout, it usually has a lot of caffeine to get you all pumped up, which if you have high blood pressure, it's not necessarily safe. So you want to look for something that's got 20 to 30 grams of protein in it and has less than 5 grams of sugar, which is the norm for a lot of them. You want to see, does it have fiber in it? And if you have any problems with diarrhea, constipation, irritable bowel, you want to see what are the sources of fiber. A lot of them have chicory root fiber or inulin, which are good and they can fill you up. But if you have irritable bowel, it's going to give you a lot of pain and gas. So you want to avoid that. You also want to see what kind of sugar is in it. So is it erythritol, which is a sugar alcohol, which is popular because it's not artificial, but it also can have a laxative effect for some people. So you have to be careful with that. And then I do get concerned with the amount of artificial sweeteners. So if you are drinking multiple per day, a lot of protein shakes have gone to sucralose, to Splenda, and Splenda does have an upper limit. So it's something that hasn't been around for a really long time. And if you're drinking loads of it every day for months or years, what is it doing to your insides? I don't know. I don't know what they're going to say, because as we talked about before with supplements, we learn more. There's a lot of research. We know that they don't cause cancer. We know about the immediate safety effects, but there is an upper limit. There's 25 packets per day. So that's a lot of protein shakes, if to be having that much, but you do want to pay attention to that. And since they don't use sugar, most of them either have monk fruit or stevia, which is safer, but they can have sucralose, aspartame, and then sometimes the sugar alcohol. So you want to know what it is that you're using for your protein shake. And I think I have another slide on protein shakes. So these are our popular ones that people are using. Premier is probably one of our most popular. That's the one that my patients tend to like the best. Slim Fast is still really popular. I recommend, if you're going to use it as a protein shake, that you get the Slim Fast high protein, because the regular one is very similar to chocolate milk in its nutrient composition. So you're not going to get as much protein. Atkins, Orgain is one that I really like. It doesn't have as many additives, and it actually has monk fruit in it, so it does not have the artificial sweetener. Designer Way, Pure Protein, and Herbalife, which is in our area, or all the Herbalifes are nutrition stores. So Bear Nutrition Store, Pike Creek Nutrition, where you go in and you get your shake. If you're doing Herbalife, the protein comes separately, so you have to make sure that you're adding that in, because it's not part of the main formula for the shake. So these do come in powders, or they come in, as you can see in the picture, the boxes. And either one, if you're going to choose to use these, you want to do what's convenient. Some of you might remember back in the 80s, Oprah was on some shake program. Now it's escaping my head what it was, since she came out with her wagon of fat and she had lost all this weight. But then as soon as she went back to her regular food, she gained weight back. It's something that she was very vocal about. So as you do, and there are hospital programs that are all shake-based, like OptiFast. So if you are using these as meal replacements and you go back and you replace with regular food, you have to be really cautious about what you're doing. You don't want to, start going back to McDonald's for your lunch after doing protein shakes. So it's something that we can always talk to you about if you feel like you need a jump start with that. So sort of bottom line with supplements, I'm ready for my next slide, is if there was a magic supplement, people would be taking it freely and you would know more about it. So the protein shakes are really sort of an option, but the supplements, there really isn't anything out there. As Katie said before, it's still a matter of good nutrition, losing weight and lowering blood sugar. It's still a matter of changing your behavior. So eating well and moving. And again, you really want to check for interactions, because there is no regulation on supplements. And I think that was my last slide. Thank you.
So I did, while you were talking, I did look it up, Amy, and it looks like it was the OptiFast that.
Okay.
Because it did talk about the fact that she had lost, I think you had said, 67 pounds.
Okay. I remember that. I remember watching it.
I do too, with the wagon coming out. Mm-hmm. But I do have a question. So I'm sure, for some people, they do need something that's very specific. We know, right? Because even in care coordination, we get patients who are calling in and they're like, can you please have Amy just tell me specifically what to eat? Mm-hmm. So I guess one of the questions I have is, if we see that this happens, is there a way to do it maybe a better way to do it. So if they start off replacing maybe lunch or breakfast with a shake, then as they're coming off of it, instead of going, okay, I was drinking a shake for breakfast 7 days a week, for the last 3 months, I lost my 25 pounds. And now I'm just going to go back to eating what I used to eat, which was bacon and eggs or whatever. Should they maybe try to do every other day? So do a shake, but then learn what to eat on those other days. Is it oatmeal? Is it, a piece of toast with an egg? Learning how to kind of convert back right from a shake, which is just like, I'm going to take this little, bottle that you gave or that you showed, and then I'm just going to go back to eating what I ate before. I don't know if you want to talk about that a little bit.
So it depends on where we are with people. I've had people doing 1 shake a day. I've had people doing 2 and then eating a regular dinner, depending where they are with their success. So what I will usually do is not have them just have a shake. I usually make them eat a vegetable and fruit with the shake. So they're already building that habit of getting in the produce, and the shakes are really low in carbs. So they're not necessarily getting a carb, and I like them to get into the habit. Okay, so I'm gonna have my shake with carrots and an apple, for lunch every day. So, and then yes, absolutely. So if we're on 2 shakes a day, we start with 1 meal at a time. And okay, what can we replace? So your shake is really protein. What kind of protein can we replace in there? What's feasible for you to pack if you're packing, or if you're buying, where do you go? What kinds of things? And we do. And you know this, that I do not write menus for people that say eat this and this and this, because it's not teaching them anything. But together we do work to come up with a list. So like if somebody goes to Wawa every day for lunch, well, let's look online. Let's look at the menu in Wawa and see, okay, what can you get that's not crazy high in sodium and really high in calories, that has enough protein that fits the bill. And and you can still get your fruit and vegetable at Wawa too. It's right there. And then one step. So we don't really start with every other day. We start with every day, but we figure out every 5 to 6 days out of the week, can you make it still fit this template? And then we do a day where you might want to go out and, while they are going out, they're going to Wawa, have something that's a little off, maybe pizza, because it's real life too. Somebody's not going to be so prescriptive every day.
And I like where you typically say you try to meet the patient where they are, right? So you don't say, no, you can never go out to Wawa and get your lunch. You try to teach them, if you're going to go there, here are the better options versus this is what you used to have. This is, maybe what you're like, okay, I like that. So I didn't realize the difference, right? In the calories, the carbs, the sugars, the everything like that, trying to teach them how to do that piece.
Yeah, and the technology is there. I mean, it's amazing. So, and people don't realize, if you go on Wawa, they have all their nutritions available online. So people will look and they say, oh, well, I didn't realize that, the meatball sub is my day's worth of salt right in there. It's or a small turkey shorty is 47 grams of carb, just in the roll. They think, oh, but it's so small. Why is it so many grams? So looking at that together, so they're able to see, because it's all out there, ready for anybody to look at. So they just need to know where to find it.
All right. Any other questions or any other information you would like to share with us, Katie?
I was just going to ask, if someone is taking the protein shake as like a meal replacement, if you think that they would be nutrient deficient in certain things, but I like that you said that you recommended taking like a fruit and a vegetable as well with that. So probably they're getting all the nutrients they need as long as they're taking those in addition to the protein shake.
Yeah. And I really like to keep it short term, because I'd rather that they eat real food that live, because I don't know. I mean, the example I always give to patients is BPA was in, I'm sure I drank out of baby bottles made with BPA, and now it's banned because it's considered endocrine disruptor. So these chemicals that are in food, I don't know what they're going to say. They're considered safe now, just like we talked about the supplements. But are they going to come out and say no?
Right. 10 years. Oh, yeah, that wasn't good for you 10 years ago. And sorry that you've done that for the last 10 years, right?
Mm-hmm. So I think eating putting in stuff that we know, like an apple or carrots or spinach, where there's no unknown about that. So we know it's good for you.
Absolutely. Well, thank you both for being here with us tonight. I think this was a great discussion and hopefully beneficial for everyone. So Amy, do you want to tell us our next date and topic?
So our next topic is our next date is July 14th, and we will be talking about home gardens and what to do with them. So Donna and Kamal will be sharing their homegrown vegetables and spices, and we will be talking about what you can do, how to grow them, and what you can do with all your summer bounty.
All right. Well, we're looking forward to that. So again, thank you, everyone, and we look forward to seeing you again in July.
All right. Thank you.
Thank you.
Good night.
Bye.